Welcome back. This is Good Morning Namibia. Now, the festive season brings excitement, travel, and celebrations, but it also sees a worrying rise in sexually transmitted infections or STIs. With social events, spontaneous encounters, and more relaxed routines, people often let their guards down, leading to higher risks. To unpack why this happens and how we can protect ourselves, we're joined today by registered nurse, Mr. Ndumba Immanuel. Good morning, sir, and welcome to Good Morning Namibia.
Good morning.
How are you doing on this gift of a Tuesday?
I feel blessed. It's another day.
Very well. For those of us who still may be struggling with the concept of sexually transmitted diseases or infections, what exactly are we talking about?
All right, perfect. But before I answer that, I just want to reassure the public that as a professional nurse, I don't just speak from the professional experience, but with deep concern of our community, our people, that STIs are preventable, but only if we choose education over ignorance, and if we choose being protection over regret, and if we choose to be safe over maybe to say ignorance as well. So all we need is to be conscious and responsible. So what we are talking about here when it comes to STI, it's more of sexual transmitted diseases or infections, where it have to be transmitted through different ways, but primarily it will be through sexual intercourse. Maybe sometimes it's body contacts, sometimes it can be via childbirth during pregnancy or at birth, and also through sexual intercourse, which can be oral, anal, and vaginals. It's more of different ways. That's how it's being transmitted. And it can be acute, chronic, it depends on the stages. So that's what we are talking about here today.
Thank you for that comprehensive overview. What's the difference between an acute and a chronic STI?
Okay, an acute, it's more of something which lasts for a shorter period of time, and it has more intense pain and I would say clinical manifestation, the signs and symptoms which people can see. But the chronic one, it lasts sometimes longer than we're expecting, sometimes months, years, sometimes it might not even heal. That's a chronic one. So mostly these are conditions or infections which you might live with for a longer period of time. Sometimes it might not pain like the acute one. So that's why it's hard sometimes to tell when someone has a chronic than the acute infections.
What are the most common STIs?
Yeah, there are a lot to mention, but the most common ones we have, especially in Namibia, and based on the experiences and nurse, syphilis, I'm sure majority knows this one, and then gonorrhea, we have HPVs, we have herpes, we have the overall known one, HIV, so the list goes on.
And how prevalent are these diseases? How often do you witness them clinically?
Clinically, okay, I would say cheers to the females, the ladies, because most of the time they are the ones speaking out. They come out and seek for medical attention. But when it comes to male, it's very hard because most of the time they prefer to heal at home. So I would say statistically wise, every day when people are attending clinical medical services, there should be either 10 or 5 people raising this concern.
Every single day?
Every single day.
Yeah.
So it's a major concern to say to the public, especially with this festive season, the cases always arise or hit the spot. Yeah.
Before we get to that, why do females seek help more than men do?
I will not say that men are not concerned or they are not worried, but I will say that men are a bit shy and they hardly speak out because of the public thing which is around the men's nature to say that they are men and all that. But female, they are more of interactive, and I would say there are more activities also including them to make them speak out. And also maybe to say most of the time, the context they involve that most of the time when you go to the clinic, most of the nurses are females, and which makes or which give the female a comfortable, safe space to speak than men. So I will still send the message out there that we need more men in this profession, so that
Yes.
we can make other men feel safe and comfortable to speak out. Yes.
However, are there risks involved to not seek medical attention for whatever reason and to
Very.
treat yourself at home? We're also showing some of the visuals of these STIs on the screens, so we'd like to apologize to our sensitive viewers.
Yes, I would say this is a very, very sensitive topic because as we speak, it's an ongoing problem, major problem worldwide, not only Namibia. As we speak, people are going through this. That's why we need to talk about it so that we can give other people hope and chance and the courage that they should seek for medical attention, because it can be, if one don't seek for medical attention, it can lead to complications which may arise in the near future, which can even be worse than the current one.
Could it induce death in some instances?
Yes, it can be in a very rare but longer time, but yes, and also mostly the infertility. Yes, it can also cause that. And also to say sometimes it affects the human arousal stimulation. Yes, and it can reduce the libido, because remember, you're not feeling well at all the time, and it affects relationship with your partner. Yes,
It sounds like a vicious cycle, but while we're at it, why are we witnessing a spike in STIs during December? What is so special about December?
Perfect. I would say, especially now, this season, which is December, which is a festive season, just a message out there that you will never know someone's STI status without medical confirmation. So trusting someone is not the same as knowing their STI status. So everyone should confirm medically with their partner before anything. So answering the question, why is it that during this time STI spikes? It's because we have too many, I would say, social gathering, a high volume of alcohol consumption, which may lead to unplanned sexual intercourse, or sometimes I would say high volume of alcohol intake can lead to what I would say lack of information, or sometimes you won't make the informed right decision. And also to say, when it comes to gathering and the excitement of new people in town or in that specific place, so it brings that excitement, and people later forget who they are or what other people brings in their life. So they just go with the entertainment way and they just do it. By the time they check, it's too late. And also lack of seeking or delay in seeking of medical attention. People delay because everyone is out there at the village or wherever they are.
I'll go in January, that's the intention.
Yes.
And it might be too late.
They might be too late because everyone is waiting that, no, I'll do it in January, I'll go to the hospital, because everyone is busy, keeping themselves busy with the family, with entertainment, with all that social interaction, and it delays medical attention, and then it can lead to the spike of the STIs. And also maybe to alert the public that for those who have a privilege to resources, transportation, and social power, they shouldn't use that privilege to exploit or take advantage of other people in connection of sexual activities.
Such an important point that you are making. You did share with us earlier that it's difficult to confirm someone's STI status, whether you love or trust them or not, without medical presence. So how do I protect myself? Are there signs that I need to be on the lookout for, that this person looks like they could be potentially dangerous?
Yes, it's quite difficult, especially for non-medical people, to tell, because these are not, like I said earlier, you cannot just look at somebody and conclude and say that they are clean or they are not having any STIs. But there are a lot of signs to be on lookout, especially if you are infected. To male and female, you should be on lookout when it comes to your genital parts. You might experience bumps, ulcers, and small sores, wounds, and all that, pimples. And also sometimes you might have a painful sensation when urinating, and sometimes you might have discomfort or uncomfortable abdominal pain or pelvic pain. And also sometimes you might, this is a common one, where there are discharges coming out from your vaginals or penals. Just sorry to say as a sensitive word. Yeah, so you might see those discharges coming out. And that's why it's very important that you don't compromise. You need to condomize, because that's the only way, because you won't tell physically to say these are the problem, because most of these problems, like I said earlier, sometimes they might be asymptomatic, meaning they don't show symptoms.
But they are still dangerous.
But the person is still carrying it, and they are able to transmit to the next person. But you won't able to see the symptoms, but they have the infections which you can, the next person be transmitted to, or they can able to spread it to the next people. So the only way at the moment, or the fastest way or solution to it, is just to condomize, don't compromise. And make sure when you are doing it, you condomize every time and consistently from the start of sexual intercourse till the finish line. There's no point where you say, I should first remove and then we put the condom later. No, it's a very sensitive, or the message which people would not want to hear, but please, we should not compromise. This December, condomize, especially if you are involving yourself with a new person.
Very well.
Yes.
What about abstinence? Is it still recommended to abstain?
Yes, abstain, it's something which majority, I would say, are struggling with. It's hard to abstain.
Why is that?
It's more of, I would say, especially with the excitement involved at the festive season, some family have missed each other for a very long time, and some, they want to try something new, and sometimes it's peer pressure, sometimes it's, I would say, stages. You are moving to the next stage. You get to hear people, teenagers, they are saying, no, I'm now 18, I want to try something new. You hear this one is telling, I'm now 21. You get this one, the family are also encouraging them to do it, to start a family. So it's hard to abstain because of a lot of pressure, or a lot of, I would say, a lot of things involved around it. That's why those who choose to abstain, we encourage them to do so. Till
If they are able to.
Yeah, if they are able to, because it's a challenge you need to take. It's a self-decision which you need to take, because it's not easy, as it says, especially if you have started. So it's hard to stay out there and stay alone, because sometimes being in isolation, it's a problem, especially now. But we encourage those who really want to take that route. But otherwise, I still stand, you need to be faithful. I think that can be the perfect way. Stick to one partner.
If you are able to.
Yeah, if you are able to. And I don't think we should say if you are able to. People are supposed to stick to one partner.
From your perspective.
Yes.
Very well. In the event that I discover that I may have a challenge during the festive season and I find myself in a remote area where medical help is far away, what do I do?
Okay. I would now advise in that case, because like now, festive season, it's December, people are going back to the villages, to remote areas where medical services might be limited. So I'll advise people already to take precautions and be responsible. For those who are coming from favorable areas, carry along your protections, which we can call the first aid, self-first aid, and also maybe first aid like maybe include your self-testing kit. Though it might be dangerous, we advise people to get counseling first before getting to test themselves. And also to say...
For HIV and for other STIs?
Mostly it's HIV, but other STI, we still ask everyone to take along condoms. Buy as much as you can for the whole holiday. And also maybe to say, if you are going in a different town where your partner is not there, abstain, wait. If you can.
If you can, indeed. In the event that the condom breaks, what advice do you have from a medical perspective?
Perfect. That one, we come across that one a lot, where majority comes to the hospital that...
Alleging that?
Yes, alleging that the condom busted and it's an emergency to us. So we always advise people to take PrEP. So go to the hospital immediately, do PrEP, do testing, get the counseling, pre-counseling, do the testing and start PrEP immediately. If you are staying far from or closer...
But that's post-exposure, so would it be PEP or PrEP?
That's post, it should be...
PEP.
PEP, sorry to say. And then Also, if you stay far from clinical services, by all means try to seek for it, travel for it if need be,
Very
because
well.
your health comes first before anything.
In the event that there may be some confusion between PrEP and PEP, can we just briefly outline the difference between the two?
Okay, PrEP, it's more of, I will put it in this content, more of you want to take precaution or prevention before anything, where sometimes knowingly that you are going to have or do unprotected sex with somebody, or it might happen knowingly, and then you are preventing yourself before anything, because you are going to be exposed to whatever the person might have. Sometimes there are people who knows 100%, but they will do it. They will take the PrEP to prevent themselves. But the post one, it's more of it happened. You are exposed already, so you are protecting yourself after, knowing that you might be in danger or you might be vulnerable. So you have to take it already.
And both are readily available in all facilities, including the state?
Yeah, at state, I will not 100% confirm at the moment at all facilities, but especially in the city, they are readily available, especially at the clinic, but we are not 100% sure with the remote area, but I still advise the ministry to at least send it out there because it's needed, especially now.
Very
because
well.
sometimes nobody planned for, especially what we spoke about now about condom breaking. No one planned that. So, and it's obviously a need for someone to rush to a clinic and grab that quickly, because we cannot just rely on private sectors, but we need to equip our state facilities with this need, because these are need prevention measures.
Mr. Immanuel, as we prepare to wrap up our conversation this morning, what final message do you have to fellow Namibians as we enter the festive season as far as STIs are concerned?
Yes, my message is very simple, that this goes to all Namibians, young and old, women and men, family, friends, that everyone should make a responsible decision. It should be informed decision. Everyone should choose to be safe, choose to protect themselves, choose to respect themselves, and choose to be conscious of every decision they make, because whatever decision they make today, it can affect them tomorrow. So we should all protect ourselves, and we can enjoy and celebrate the season while we still safeguard our health and health of those who care for us. So my last message is we should just protect ourselves, and to send a message out there that as we are driving, we should pack our kit so that we can go protect ourselves wherever we find ourselves, and also maybe to drive safe, because
And
it's
perhaps
festive
also
season.
check the expiry date of the condoms.
The condoms, and mostly try not to participate in sexual activity when you are under influence, because you won't make the right choices or decisions.
If you can.
If you can, but I advise that we should be conscious.
Very well.
Yes.
So thank you for your time, and thank you for sharing your expertise so altruistically and generously. We appreciate that.
Thank you so much. I appreciate too.